In what appears to be a move to ease the hard-hit health system in the country since the importation of COVID-19, the government has announced plans to leverage on home-based care for about 80% of patients currently in isolation facilities across the country. Health Cabinet Secretary Mutahi Kagwe says the move will free health facilities of congestion.
We have realized that over 80% of our patients in hospitals are asymptomatic, and therefore baby can and may be managed from home. If this is implemented, it would free our health facilities from congestion. Because we are reaching, for example, in Nairobi, at a time when both Bagathi and KU are already getting to full status. The Ministry of Health is in the process of actualizing, and indeed we have already completed the process of actualizing home and community-based care protocols for rollout and to be implemented countrywide.
According to the World Health Organization, patients presenting with mild illness from COVID-19 can be managed from home to help ease the burden on the healthcare system unless there is concern for deterioration. WHO says this decision requires careful clinical judgment and one that has to be informed by an assessment of the safety of the patient's home environment.
Where no such and where families are not able to either self-quarantine or self-isolate, the government will still assist in the process. But I would like to make it clear that a time is coming when we cannot continue as usual, that we have to change tax. Taking care of 500 people is not the same as taking care of 5,000 people. And obviously 5,000 people is a completely different ballgame from 50,000 people. We have learned over the last 3 months or so, we have been in school learning how to manage this disease, understanding this disease, going with the protocols that we are learning from other people. But now the time has come when we must also begin to implement our own systems in our own place, depending on our own environment, and because it is the only way that we can be able to cope with what we are expecting in the future.
In the event home care is to be provided, the World Health Organization states that a trained healthcare worker should conduct an assessment to verify whether the residential setting is suitable for providing care. They must also assess whether the patient and the family are capable of adhering to the precautions that will be recommended as part of home care isolation. It further goes on to specify that household members should place the patient in a well-ventilated room. They should limit the movement of the patient in the house and minimize shared spaces like the bathroom and kitchen. They should also limit the number of caregivers and preferably assign one person who is in good health. The caregiver should wear a medical mask when in the same room as the patient. Daily clean and disinfect surfaces that are frequently touched in the room where the patient is being cared for. Always use gloves and protective clothing like plastic aprons when cleaning surfaces or handling clothing or linen soiled with body fluids. WHO further advises that gloves, masks and other waste generated during home care should be placed in a waste bin with a lid in the patient's room before disposing of it as infectious waste. Sharing of items like toothbrushes, eating utensils, towels, clothes or even beddings among others is not advised. Gloria Milimu, K24, Evening Edition.